Bismillahirrahmanirrahim. Ladies and gentlemen, this is Dr. Abdul Basit Malik. Today's video is very important. It is about how modern medicine considers nutrition, food, and dietary patterns in the treatment of different diseases. Keep in touch with me till the end so that you can learn a lot. Wherever it is needed, please take the notes. In these series of videos, I am discussing alternative medicine and food concepts and theories in different popular medical fields or different popular paths or types of medicine. So starting today with the modern medicine, as I have discussed, that this is called evidence-based medicine. Nutrition is actually a part of this medicine, but in fact, the nutritional component of the medicine or modern science has been not changed, but it has been isolated into a different field called the nutrition, or the people who learn it, they are called nutritionists. So they learn the art of nutrition, and in the modern system of practice of medicine, they help doctors and they incorporate their knowledge for different diseases, and in fact their role is very important in the in making manuals for different hospitals, for different nursing homes, for different people suffering from different diseases, as they are advised by the physicians or the practicing physicians. Then I have also studied integrative nutrition, which is a concept of nutrition which is being taught in the Institute of Integrative Nutrition in New York, and it is unanimous in the sense that it gives the idea of bio-individuality, that as a person is specific in its genetics, so it's their food should be specific for their various issues and illnesses. However, the practicing physicians, unfortunately, they are definitely taught about the nutrition, but they do not, in fact, practically teach their patients about different foods and nutritions, what to do and what not to do, apart from a general little advice. For instance, if someone is suffering from blood pressure, they will say, okay, stop taking salts, you will get salt retention, salt and water retention, and blood pressure cannot be controlled. Similarly, if someone is suffering from cardiovascular problems or stroke, they will say, okay, do not eat a lot of fats, try to minimize the fat. And in case someone is suffering from obesity, they will say, okay, control your food to a limit of calories. So unfortunately, the practicing physicians in the field of modern medicine are not incorporating practically the knowledge of nutrition in depth, and they redirect their patients to the nutritionists with the advice of telling them to control the fat, to control the carbohydrates, to control proteins, and according to the type of diagnosis, they tell them to control the calories or to restrict the calories. Now, however, with the with the passage of time and with more advancement in the medicine, some branches of this medicine, particularly the endocrinology and the endocrinologists, because they are more concerned with the widely expanding disease of diabetes or insulin resistance. So they are now studying or incorporating their knowledge of nutrition into their practice. Similarly, in the world, about 30% of the population of the world is definitely having little or more obesity, and the same amount of population is suffering either from type 1 diabetes or from type 2 diabetes, or they are pre-diabetics. So this is becoming a great concern for the practitioners in modern medicine or in endocrinology to control the reasons and causes of uh, these diseases, and they all exist in modern food. And now this is being incorporated. The knowledge of food and nutrition is now deeply studied and is being incorporated in the field of medicine also. So generally, the nutritional concepts of modern medicine, they rely on the type of foods or their groups of foods, you can say. So they group them in carbohydrates, fats, proteins, and then they are the macronutrients, and the micronutrients, they are the vitamins and substances related to vitamins, some minerals like zinc, chromium, magnesium, calcium, iron, phosphate, sulfates. So the knowledge of modern nutrition is grouping the types of foods into these categories, and then accordingly they are incorporated or they are told to their patients suffering from various diseases. Now generally, different food patterns, as they are advised to different people, they actually proportionate different types of or groups of foods. So for example, some people will say, like the standard American diet, it says 50 to 55% of the food requirement or the calorie requirement should be coming from carbohydrates. Similarly, about 25% should be coming from proteins, and 10 to 15% should be coming from fats. Now, this was theoretically being followed in the previous 70 years almost in the United States and Western world, and it has disastrous impacts on human bodies, and we have led towards metabolic disorders, we have led towards diabetes, type 2 diabetes, which has become so common in all the ages and folks that now there is a danger that by the end of 2030 almost 40% of population in the United States will be suffering from this deadly disease, because the complication of diabetes, they are dangerous and deadly and very much painful, as it leads to renal failure, as it leads to stroke, as it leads to cardiovascular diseases and different forms of hormonal imbalances. So the concentration is now being made to alter these dietary and food concepts, and it has been tried to give the knowledge to the people to uh, follow different guidelines. Now, many researches are being tried, and different theories of food and nutrition are in the process of evolution, are in the process of study, and the people related to modern medicine, they are practicing, are trying Atkins diet, paleo diet, keto diet, carnivore diet. Different forms of diet are being suggested to the people. Now, are they working? Are they good or not? So this is quite a debatable thing, and I will say it is different from person to person, and it is different for people living in different areas. While studying this, they forget to consider the atmosphere, the weather, the temperature, and the area the people are living. And there we need the alternative medicine concepts, the alternative concepts of food and diet in different medicine, so that we can tell the people of different areas what they should actually do in their issues and problems. So I hope we will continue with this discussion, and you will enjoy this series of videos. I will try to educate in details all different concepts of food and nutrition in different theories or ideas or fields of medicine being practiced all across the world. Thank you very much for joining this video. Stay tuned with me for my next video, which will still be the same or similar, the concepts of food and nutrition and different problems and diseases according to modern medicine. Thank you very much.